We'll start in a few minutes.
Speaking of the plane. And remember, it's a Monday morning. So you need to calm yourself down.
Yeah.
Right. It's in only a matter of time. The real manager is sleep.
Prof, 30 is a good number to start to.
Oh, yes. That is a good number to start. Thank you for drawing my attention. Good evening, ladies and gentlemen. Good morning, good afternoon. Depends on where you're speaking from. Where you're speaking from, beg your pardon. Kindly mute your mic, except you are called upon to speak. Mute, so we don't have interruptions. The session is being recorded and will be on YouTube shortly after this meeting. Welcome you to this webinar, which is a monthly outing of Mind and Soul Helpers Initiative, an NGO which we started about 5 years ago, designed to create awareness about mental health in the Nigerian public and worldwide.
Yes.
Of course, we know that there is a lot of ignorance about mental health around the world. It is misunderstood, it is misrepresented, it is stigmatized. Today, 10th of October, is World Mental Health Day, and it is celebrated on the 10th of October. Our regular webinars come up on the very last Saturday of the month, but today, being Mental Health Day, we thought we should have an outing. This year's theme set by the World Federation of Mental Health is Workplace Mental Health. The theme highlights the importance of addressing mental health and well-being in the workplace for the benefit of people, organizations, and communities. I said in my introduction that mental health disorder is often hidden, stigmatized. People are made guilty about their illness. It is an illness which the sufferer may not be aware of, but he is punished. In some societies, it is called spiritual attack. Some say it's witchcraft, all kinds of things. So we need to create awareness about mental health. I recall when I started this program on Facebook and I added some persons. One of the reactions I got was, hey, look at this man. He went to add me to a mental health group. At the Grace, I could go add me to that kind of group. You know, and I said, well, there is widespread ignorance. There are different dimensions to it. There's a general depression, there's suicide, which is common these days, young people taking their lives, and some people are attributing it to spiritual attack and all the rest. So today, we are going to look at a particular aspect of mental health, which is titled Mental Health, Mental Disorders of the Elderly, an Emerging Public Health Crisis. To deliver the lecture is Professor Olurotimi Koka, MD, MSc, Psychology, FWCP, Psychiatry, Clinical Psychologist to Consultant Psychiatrist, the Professor of Psychiatry, Lagos State University. And he's also one of the very strong members of Mind and Soul Helpers Initiative. But my very first encounter with a psychiatrist was with Professor Olurotimi Koka, then Dr. Koka. I have the honor, therefore, of presenting to you the versatile, dynamic, lively, vivacious, boisterous, and friendly Professor Koka.
Thank you very much. Thank you very much, Professor Hupekaga. I want to thank you once again for this opportunity. Good evening, good afternoon, good morning, depending where you are in the whole world. And the month of October is the Mental Health Awareness Month. And today specifically is the World Mental Health Day. And every mental health expert is supposed to give a lecture or give a discussion about mental health issues in order to reduce the stigma and the discrimination associated with people suffering from mental disorders. And today there's an emerging public health crisis. Mental disorders among the elderly. And that has been neglected. And that's why I said this lecture, for those above 50 and above, they must attend this lecture. That's the outline. Briefly, in the next 30 minutes, we'll discuss the introduction, definitions, loneliness, depression, dementias, prevention, and the management. I hope you can see my slides, please. I hope you can see my slides.
Yes, you can see your slide.
Oh, thank you. So we are getting older globally and all.
Your slide is static.
It's static.
Yes, it's on the title page alone.
We might need to manage this.
Yeah, it's okay now. We are now in introduction. Thank you.
Yes, before then, that was the outline and now introduction. Now we are getting older globally, and by 2030, 70 million people will be above the age of 65, and adults with mental health disorders will reach 15 million. And there will be increased amount of mental disorders in the population, including Nigeria. However, we must be aware of our health. And the World Health Organization defined health as a complete state of physical, mental, and social well-being, and not just the absence of disease or infirmity. So for you to boast to be healthy, you must be healthy physically, mentally, and socially. But we're going to talk about the mental health aspects of being healthy. And that's the definition of mental health and well-being by the World Health Organization, that the individual must maximize his abilities and potentials. So if you want to be happy and keep happy, you must keep doing what you love doing. Cope with the normal stresses of life, and there's a large, humongous amount of stress in Nigeria, and we must be seen to be coping. We must be fruitful and productive anywhere we are, and also to contribute a quota to our community with our time, talents, and treasures. And that is what MASHI is all about. It's an NGO that's providing awareness to people about mental disorders. So all of us must join an NGO that we find that have worthy causes. Now, one of the emerging pandemic amongst the elderly is loneliness, and people are not talking about it. It's the experience of feeling disconnected with people and a lack of meaningful social relationships. So the elderly may even be living in the family house and still be lonely because nobody wants to connect with grandpa or grandma. Nobody wants to take grandpa or grandma out. So despite the fact that he has physical presence, but he may still be lonely. And lonely is a form of social isolation, physical solitude. And the causes include living alone, diminished family ties, and reduced social interactions, especially after retirement. When we are lonely and we are isolated socially and physically, what are the consequences? Early deaths, poor immune system, we become susceptible and vulnerable to infections, increased heart conditions, reversal of sleep. The individual may sleep during the day and may not be able to sleep at night. And the development of chronic illnesses, if he hasn't developed one by that time, such as hypertension and diabetes and cancers. The social effects include reduced participation in social engagement, social isolation, withdrawal, and living in squalor, which may affect the personal hygiene and care. The mental health consequences, increased risk of developing depression, schizophrenia, dementias, lowered self-esteem, brain functions may decline. And sometimes some people may even start new drug abuse as a form of coping mechanism, sleep disturbances, poor stress coping abilities, and most importantly, feelings of despair that can bring about guilt feelings, feelings of worthlessness and hopelessness, that is this life actually worth living? And that's when they start to contemplate dying by suicide or actually attempting suicide. So what are the solutions to loneliness? We must, all of us in this lecture, must promote social engagement for the elderly in our communities. We must encourage social connections with families and friends. We must tell them to volunteer, to stay connected with the society. And this is why you also encourage them to be active in their spiritual organizations, their various churches or mosques. And we must teach our grandpas and grandmas, all of us this call, the use of social media. I recollect one grandma who was 80, and the children taught her how to use Facebook. And her first speech on Facebook was, is there any grandma on Facebook, or is there any grandpa on Facebook? So we must teach ourselves to use Facebook, Instagram, and TikTok once we're above 60. Another popular emerging mental illness among the elderly is depression. It's also on the increase. 10% to 28% of the elderly above 25 will develop depression. And the World Health Organization reported that the prevalence of about 14% for people above the age of 60 years. So depression is common for amongst the elderly. So what can lead to depression? Usually at the age of 60, the elderly will have lost a loved one, a spouse, a child, a sibling, retirement, loss of income, reduced economic status. Some will actually end up in poverty, lowered education, and they might develop chronic physical ailments like diabetes and hypertension. And these days, these medications are extremely expensive. And when you cannot afford your medication, it can lead to depression. There's social isolation that we talked about, or poor social networking. And how do you recognize depression in the elderly? These are the core symptoms of depression. Persistent sadness, low moods. And the person also talked about poor energy, not having energy to do anything, and loss of interest in pleasurable activities that hitherto gave joy and happiness. And associated with this are these other symptoms: poor sleep pattern, either sleeping too much or not sleeping at all, appetite changes, weight loss, feelings of guilt, feelings of worthlessness, hopelessness. And this is when, so you now have these symptoms amongst the elderly. But the core three symptoms are persistent low moods. This Baba or this Mama is always sad, always melancholic, and always weak. And Mama that used to enjoy watching African Magic, or the Baba that used to love watching Chelsea, doesn't want to even put on the television. So when you have our elderly manifesting with these signs and symptoms, they actually indicate that the person may be experiencing depression. And depression, if there's early intervention, there's total cure. And the intervention for depression is psychotherapy, also called talk therapy. And you carry out some form of what we call the cognitive behavioral therapy to psychoeducate the individual, to psychoeducate the family of the elderly, the spouse, the children, and what they need to do to keep Baba happy. And if talk therapy, psychotherapy is not as effective as we desired, then we can add antidepressants. And the common ones these days are called selective serotonin reuptake inhibitors, SSRIs. And these are the common ones that we use in Nigeria. Citalopram. For the medical doctors amongst us, these are the doses. Sertraline, fluoxetine, and Exide. They are very common. They are available in all pharmacies in Nigeria. So when we are giving a psychotherapy and we are not happy with psychotherapy, we can add pharmacotherapy, that is medications. So we'll also go to what is trending right now, dementias. I have 2 patients I'm treating right now that have dementias. And what is unfortunate about this is that they are below 65 years. Usually dementia starts from 70, 75, but these days we're seeing them in younger years. And how do you recognize dementia? The person will lose his or her memory. It is progressive, not just a sudden thing. And the poor memory will also lead to poor judgment of issues. And the poor memory and judgment will affect his communication and social skills. The thinking pattern of the individual that may be severe enough to affect the person's personal and social activities. So loss of memory, loss of poor judgment, loss of social skills, thinking patterns may be affected. Even there will be personality changes. So what can lead to dementia? It's an illness of the elderly, usually seen above the age of 65. Sex, twice as common in women above 65. Why? Because women tend to live longer than men. It also runs in the family. If some parents have had dementias, such as Alzheimer's, it can be passed down to the offsprings. Then excessive drinking of alcohol and excessive smoking can also lead to dementias. 55 million people statistically are living with dementia globally. And 60%, more than half of those people are in the low and middle income countries, such as Africa. And it's estimated by the year 2050, this number, 153 million people, will develop dementia globally because of the population growth and aging population too. And in Nigeria, statistics and studies have shown that 10 million Nigerians actually are experiencing and maybe suffering from dementia. And this study in Lancet claimed that by the year 2050, 367% will experience of the people globally will experience dementia, and most of them will be in Africa and the Middle East. Now, what can lead to dementia? It's a disease of the brain, like I said. So, brain cells death caused by wear and tear of the brain, progressive wear and tear of the brain, or shrinking parts of the brain that controls memory, excessive alcohol intake. You see, when we've been taking alcohol from the age of 20, 30, 40, 50, 60 years of heavy drinking of alcohol, it can also be a cause of this kind of a condition. Most importantly, uncontrolled hypertension or frequent stroke, infections of the brain, such as HIV or COVID at that point in time, cancers of the brain, and head injuries from road traffic accidents. There are many types of dementias, but the most common one that people are talking about is this Alzheimer's dementia. Why? Because Alzheimer's dementia does not have a cure. But the other curables one are the infarcts, dementia, the ones due to infection, the ones due to nutritional deficiencies, the ones due to liver and thyroid and kidney diseases. So these are the curable ones. So once you treat the underlying condition, then the dementia is reversible. However, these are the irreversible and untreatable dementias. And the most important one that is causing this problem is Alzheimer's disease. So what is Alzheimer's disease now? Loss of memory for short and long-term events, forgetting to do simple household tasks like brushing teeth or washing plates, and in severe cases, the person may not recognize his or her children, will not recognize their names or even their faces. They look strange to him. He may look confused, and for that reason, he may become aggressive and hostile towards family members. Some were found to be hoarding rubbish, and the speech may become irrelevant and sometimes incoherent. And in the severe stage of this condition, there's disorientation to time. He doesn't know the time anymore, whether morning, afternoon, evening, even to place where he is. And sometimes he may even forget his name. If he goes out on a familiar street to take a stroll, he may not even recognize the way back home. So they get lost easily. So when you see some elderly people on the street getting lost, they might be actually experiencing this kind of dementias. They cannot go to the supermarket anymore because they cannot handle simple arithmetic such as 10 minus 7 or 100 minus 7. Their personality changes. They become irritable, suspicious, fearful. Sometimes they neglect their hygiene. They urinate and defecate anywhere, and they may even become disinhibited. They can strip naked anywhere in the house or talk dirty anywhere. And this is the reason they bring them to see the psychiatrists. Delusions, serious suspiciousness, paranoid beliefs, then hallucinations, seeing things or hearing things other people cannot see or hear in clear consciousness, which may be very, very distressing, not only to the individual and also to the family of that person and even his carers or her carers. So how do you know that somebody is suffering from dementia, especially Alzheimer's dementia? The history, the story from family members will indicate that there's been constant decline in intellectual abilities of the individual, who may be very cerebral or brainy before then, impairment of social functions, inability to integrate socially, or there might be history of suffering from stroke recently, or head injury from road traffic accidents, and a positive family history. Now, for the medical people amongst us, this questionnaire will quickly determine whether somebody is experiencing dementia or not. It's called the Mini Mental State Examination. It can be downloaded from the internet, and the person is asked some few questions, about 10 of them, and they are scored. The normal score is about 30, but scores lower than 23 will indicate that the person is experiencing or suffering from dementia. So that may confirm your clinical suspiciousness. So this psychometric tool can confirm whether the individual is experiencing dementia or not. So what to do and where to get help? Of course, if you observe that somebody is experiencing dementia, all you need to do is approach your family doctor, who will carry out some investigations and also initiate treatment. The investigations may indicate that it's a reversible type of dementia caused by comorbidity of other medical conditions. And if the dementia is not improving despite treatment, then the person must be referred to a specialist who is either a neurologist or a psychiatrist. And these specialists can be found in general hospitals, teaching hospitals, and federal medical centers. And the specialists will most especially educate the family members about what dementia is all about. The cultural interpretation of dementias that is not from the village people or from spiritual or cultural attack because Baba is very rich or Baba has just made some money. And the specialists will reduce the tension and misunderstanding amongst family members about the etiology of the causation of dementia. And like I said, if you carry out we carry out laboratory investigations, we might find out that dementia is caused by some of these physical disorders: hypertension, stroke, diabetes, kidney, liver, depression, even liver disease, even depression may manifest dementia. So once you treat these underlying conditions, the dementia becomes reversible. However, again, to clinically confirm dementia, the individual has to go for MRI that will look for structural changes in the brain and some spinal fluid analysis. And you can find some beta amyloid deposits also to confirm the diagnosis clinically. How do we help them? You carry out psychotherapy. Most importantly, educational therapy to explain to the patients the nature, the cause, and the management of the condition. The therapists also explain the extent of their disabilities. However, the areas of intact functioning should be maximized. And we help them by keeping calendars around them so that they can take care of the orientation. Papa is taught today is Monday. Today is Thursday, the 10th of October. And once you keep reminding them, it helps them with their loss of orientation. And for those that have mild memory issues, they must take notes around with them so that what they don't want to forget, they write it down. Now, is Alzheimer's dementia treatable? The ones that are treatable I've mentioned it, but this particular one that is causing concerns globally, Alzheimer's dementia, is not treatable. As of today, there is no cure for Alzheimer's. The medications can temporarily reduce the symptoms or stop the disease from getting worse. So available medications in Nigeria that we can get: galantamine, donepezil, memantine, brexpiprazole, and lecanemab. However, recently, I think early this year or last year, these two medications were introduced in the USA that actually stop the disease, like I said, from getting worse. But reversible, I doubt it. Once you notice that grandpa or grandma is having mild memory loss, that is the time to talk to his or her lawyers to instruct the lawyer what to do once he loses his memories totally. And for those of us above the age of 60, if you have not made your will, this is the time to take this into consideration. Go and do your will, because we don't know when dementias might set in for people above 60, 65, especially those above 70. Yes, prevention. We must keep very active social life and connections. And that's the beauty of joining social clubs. I can see our senior boss in Island Club on the call, in Yoruba Tennis Club. So once you join this club at the age of 50, then you have a very rich, robust social life, which is the ability to initiate and sustain quality relationships. For example, if the older person has just developed dementia, and ask him or her to start a new social life, difficult. So that's why people above 50 or 40, below 50 should join social clubs to make new connections. We must volunteer in our communities, and that's why we volunteer in our churches and mosques, YMCA, volunteer to do things. You must be able to engage with other people in the community. We must take part in group activities, sporting activities, even as the elderly. To keep our brains active, it is pertinent that we read books every day. And it's not too late to learn foreign language like French or Spanish or Italian. We are retired anyway, so that we do our time. Or learn a new musical instrument, join the choir, learn to sing in a group, or try new hobbies, gardening, knitting. And also, we must give that brain the rest it desires. We must sleep for 8 hours. And for those of us, I still have friends who smoke and drink excessively. So we tell them, stop smoking and drink responsibly. Also, to further prevent, we must carry out brain challenging activities such as chess. We must learn to play chess. And Monopoly, Ludo, crossword puzzles. Ask our children to buy us books of crossword puzzles, Sudoku and things like that. Learning second language and going out. In the clubs that I belong, you have the elderly getting there for 10 a.m. They eat their lunch there. They connect and gist and talk with their colleagues over there. They stay with till 5 o'clock when people like us who are working will go and meet them. They connect with the younger people. They have their dinner at 6 or 7 and they get home by 8. So that is how to live a very rich social life, which also makes the individual to be charismatic and influential at any age. Our diets. As elders, we must drink plenty of water every day to avoid dehydration. avoid salt, fatty food, sugar, reduce alcohol, eat more of fish and seafood more than the red meats. The Mediterranean foods were observed to prevent development of Alzheimer's disorders. Beverages such as coffee, especially cocoa drink, and green teas can also reduce the risk of dementia. And of course, multivitamin supplements are rich in vitamin A, C, E, and B complex can also, and that's of course the elderly, because of our poor diet, must also take these supplements. In Nigeria, we have support groups now where families and friends of people with dementia have come together to start the Senile Dementia Association. They carry out continuous education and enlightenment seminars and workshops to help families and patients to cope with Alzheimer's disease. And that's what MASH is doing here, educating the Nigerian populace, creating awareness about diseases of the elderly. Very important too, spiritual and community leaders should train some community members to identify the older people that may need mental health services, to also identify isolated elderly who are at risk of developing mental disorders. So church, mosque, community leaders must have community younger members that will trace older people who have been isolated and withdrawn, are vulnerable to develop. And then once they identified, there should be a community nurse who will carry out psychiatric evaluation and provide appropriate management. Of course, if the nurse cannot cope, she or will refer to the appropriate specialist. So all of us must train people in our communities to identify older people that are in isolation, that live in squalor, that are socially withdrawn, that may also benefit from community engagement. We must reach out to them. Why are things not working for the geriatric people globally, especially in Nigeria? We have very few geriatric psychiatrists, maybe 5 in Nigeria. In fact, fewer geriatric psychologists. The current estimated needs, we need about 5,000 psychiatrists, even 5,000 geriatric psychiatrists, 5,000 geriatric psychologists. Like I said, maybe we have 5 in Nigeria. I even fear of this. And more than 10,000 nursing and allied healthcare providers to take care of our elderly. And that, I don't know when this will take place, maybe not in our lifetime. So to conclude, to prevent mental disorders as we age and grow old, we must seriously take care of our physical and mental and social well-being, most importantly, social well-being. And policymakers must take urgent steps to address old age mental health challenges. All of us must intervene in alleviating the suffering of older people with mental disorders. And the best intervention is to carry out the preventive behavioral lifestyle changes. On this note, everybody on this call, ladies and gentlemen, I say thank you very much for your wonderful attention. I am grateful. Thank you.
Thank you. Thank you for this wonderful presentation.
Thank you.
On mental health of the elderly. There's a sense in which all of us are involved. Even if you're not up to 60, you have persons who are over 60 around. Your grandfather, grandmother, uncle, aunties, different persons in church. Some don't come to church anymore, they're home. We've been told that for us who are moving on, we should try to be sociable, to join social groups, such groups, clubs, different types of associations, so that we can get busy. It's important. for us to do so. We want to thank you for this clear, very important lecture. So we now throw the floor open for the next 20 minutes. If you have questions, you have comments, feel free to do so. If you want to send your questions to the chat box, do so. The mic is open. Once again, yes, okay. Dr. Mustafa Sombe, you have the mic.
My prof, here and there, Professor Egaga on one side, Professor Olurotimi Koka on the other side. I am just thinking that I should like to first of all say congratulations to everyone, and special congratulations to Professor Olurotimi Koka. And I must acknowledge the fact that the presentation was really designed to speak not essentially to only professionals, but to everybody that we call general public. But my concern is there is need for psychoeducation of the public on mental health. Where can you say you locate Nigeria from 0 to 10 so that people in Mashi can seem to understand what better we can do? Thank you, sir.
Okay, thank you. We'll take, do you want to respond, or we'll take about 5 questions first?
Okay, let's take the question first so we can respond at the same
All
time.
right, okay, thank you. Yes, Patience Ubo, I can see your hand is raised electronically. Raise your hand electronically if you have a question.
Actually, we are sharing a screen. It's Dr. Ugo that is speaking, rest his hands. Actually, use her hand to raise mine.
All right.
Yeah, mine is more or less not really a question. Professor Olurotimi Koka, what a fantastic presentation you've given. And I think you within this short period, you covered almost everything, and I just want to re-echo something that I think is probably one of the most important messages we can take away from what Professor Koka presented. And that is the area of social interaction. Prof, you talked about loneliness, and loneliness is one of the biggest problems in the world. I totally agree with you. But there are a lot of things that we can do practically right from this moment onwards, not just waiting for when you are 50 or when you are 60 or 70. And that is to engage in relationships. For instance, we have this cultural belief, I hope that is going off now, that when you are a certain age, you can't do certain things. I.e., for instance, somebody who used to go to nightclubs every now and then and interact with people, when he's 60, he's not supposed to be seen around, nightclubs again. That's, those kind of beliefs are counterproductive. Whatever social activities we engage ourselves in from the onset, we should learn to continue to do them to our oldest age.
Yes.
Associations like the Island Club you mentioned, you don't have to be, belong to Island Club if you can afford it. There are also a lot of other associations. For instance, the one I found quite very, very useful is school alumni. I belong to my secondary school alumni. I belong to my university alumni, especially secondary school alumni, where you have friends from your formative years, friendships that have lasted over the decades. Those are very, very important, alliances you can have. And when you have those friendships in your heyday, you will find them very useful. You'll find them very useful for people of like minds who understand you, who you can interact with, and who you can reminiscence with, things that happened in your younger days. So those are very important things to consider. And yes, Prof, thank you very much. I just thought I should just give you a few, just to hammer in your point for people.
Thank you, sir.
Thank you. Yes, thank you. Thank you, Dr. Ugbo. The next person here is Pam Esiri, followed by Edna Abide. Pam, you have the mic.
Good evening, Prof.
Good evening.
Thank you very much. This lecture is very, very informative, educative, and it's all enhancing. Thank God for today, that is a World Mental Health Day. My question is, this awareness is just getting, to us. It's a new concept that is coming, though it has been an issue, but it's now the awareness is gradually coming, because our people shy away from certain ailments. They feel shy because they feel if I come out to say I have this kind of a problem, people will laugh at me. It becomes a stigma in the family. They tend to stay with it and die in that silence of whatever ailment. So I want to, appeal that, the likes of you can help, design programs, to make it a compulsory, to create further awareness in our society, in our environment, so that we begin to have the consciousness, in order to, on how to really take care of our health when it comes to our mental condition, health condition, especially when we are gradually aging, and then, make sure we... Hello?
Carry on, please.
Okay, yes, I think, I am done. I'm only appealing that Prof and the likes of Prof should create further awareness and make it like a standing policy for everybody to be well informed.
All right.
Thank you, sir.
Thank you. Thank you. Now, Pam Esiri. Unmute. Unmute. You're still muted, Pam. You're muted. Unmute. Unmute. Yes, while she's battling with the mute mic or the mute button, it's clear that all of us are involved, and that as we grow older, we should be aware, and we should also try to create awareness. Pam, you are still muted. You are muted. I can see you are speaking, but your mic is muted. Unmute. You can call one Gen Z person to assist you. But you are very good at these things. I don't know what's going on today. Try to unmute. Okay, while you are battling with that, I invite Professor Coker to respond to those 4 questions first, and we shall return to contributors. Yes, Professor Coker.
Yes, unfortunately, I had issues with my internet, so it went away for like 5 minutes, so I wasn't able to listen to the last 2 questions. However, I like what Dr. Ubo says, that you must connect socially, not just before you become an elder person. For example, from the beginning of the lecture, I said the definition of health is a complete state of physical, mental, and social well-being. But most people don't actually know what the social well-being is all about. Actually, to develop social intelligence and social wellness and well-being, you must have that capacity to initiate and sustain mutually quality relations with people anywhere you are. So if you find yourself in a one remote village in China or Japan, you are able to make friends easily. And that works make people charismatic and influential. And that's what they do in those social clubs. They continue to sustain relationship and friendship. And if we can develop that culture and that ability, before we become elders, wow, it's going to take care of our loneliness, at least, and then take care of most of our mental issues. And then regarding what Mashi can do about these adult conditions, we are doing very well. We will continue to initiate discussion, not only on mental disorders among the elderly. It's just part of it. Mental disorders amongst children, mental disorders amongst women, adult mental disorders, substance use disorders. However, Mashi is doing very well. Maybe another subcommittee of Mashi can then carry out enlightenment program, outreach program, public education about mental disorders in the elderly. And that, like I said, we also need to encourage the community leaders to have community younger people that will look around to identify those are vulnerable. So Mashi will keep on this discussion, will keep on encouraging members to partake in outreach activities. Somebody said this society is very hostile towards the elderly. Just one, I'm reading now. Yes, we are very hostile towards the elderly, and that's one of the reasons why they develop mental disorders. Not only hostile by the community, even by their children, they are hostile towards parents. So I didn't get the third and fourth question because I had issues with my internet.
She's also asking, why do the elderly ask for time repeatedly?
Because they forget about time. I said it. They are disoriented in time, place, and person as the condition gets worse. They don't even know where they are anymore. And then they ask about, that's why I said you must help them in their orientation. Put calendars where they can see it. Tell them time every hour. It's 5 o'clock now, it's 6 o'clock, so that they won't disturb their children asking about time regularly.
Okay, yes. Professor Ajayi.
Yeah. Thank you. I appreciate our speaker. God bless you.
Amen.
The question I have is this. You mentioned that the issue of Alzheimer that is uncurable.
Yes.
That there's no cure for it. Now, there are many elderly people, particularly in the village, who seem to be having this problem. Does that mean that there is nothing they can do to help them out of the difficulty?
In the past, we used to see senile dementia in elderly village people, like you mentioned, people above 75, 80, that they have lost their memory. I mentioned there are some dementias that are reversible. The ones caused by infections, by liver diseases, by kidney disease, but the ones that has to do with the degeneration and deterioration of brain cells, as we speak globally, sir, there is no cure. So there's nothing we can do. And that's why today, my patients that are suffering from, they have carers. Some people are rich, 2 carers in the morning, 1 female, 1 male, and 2 in the afternoon, 2 in the evening. And those that are not that rich, maybe just 1 carer that will stay with Papa or Mama all through the day, 24/7. But there's nothing we can do as we speak, sir.
Okay.
And then, of course, you now see some religious and then cultural people trying to milk the people suffering from this condition, that it's reversible, don't mind the doctors, take coconut oil, take this, take that, use that. Statistics worldwide, research worldwide says as it is incurable for now.
All right. Thank you.
Thank you. There are more hands up. There are some made a comment there that she knows somebody, the ballet in a village, who is 96 and can recall what happened 50 years ago. There are some people like that. Yes. Very clear, lucid. Oh, yes. There are some from 63. They start getting confused. So there are other factors. I'm sure the specialists will address that. Kolawole Akindele, yes, please.
Everybody, good evening, Professor Rotimi Koka. You've really given us a good lecture. We appreciate it. I also played tennis this evening, but when I saw your notes, I said, no, I must be home and listen to this. Thank you very much for.
Thank you.
Thank you.
My question is this, right? You've been doing good work. This is not the first time I'm listening to you like this, and it's constant.
Thank you.
And it's constant with people of our group like this. But my concern is to the general public, public health, right? Down to the grassroots, right? As a public health officer, how do you, or is it part of the program, right? Government program, public health program, to disseminate things like this to people at the grassroots? I have a particular issue. My childhood friend, right, a chartered accountant like me, and we worked together for years, right? He was not socializing, but he was very religious. 2 years after retirement, he went to dementia. His wife called me and said, Mr. Akindele, your friend cannot recognize you anymore. And we were together for almost 40 years. I met him and asked him, what's my name? What he told me, I know you now. I said, what is my name? I've almost in tears, right? For me, if he had been educated about this couple of years before this, he will have seen the sign. He probably did not see the sign before it generated to this. My question is still this. For our group, fine, we can have more access now, time. But for the generality of the public, what's the government or the public health officers doing to let them know about it? So go to the marketplace with the grassroots to let them know. Thank you.
Yes.
Thank you very much. That's a very brilliant question. Unfortunately, the public health experts, they are not doing anything. Unfortunately, the Ministry of Health in both local government, state government, and federal ministry government, they are busy with other health issues, and they are less concerned about mental health. And that's why this October is a World Mental Health Awareness, especially today. So if the federal government, for example, I'll give you an example. Lagos state governments do not have adequate facility for mental health treatment of Lagosians. They only have very few beds in LASUT. And Yaba, Federal Neuropsychiatric Hospital Yaba, is the only facility available in Lagos for a population of 24 million. And nobody wants even to go to that hospital. Even if you go to that hospital, you won't find any bed. So the onus is on you and I to continue to carry out public education through what Mind and Soul Helpers are doing with this. Can you imagine? We're going to reach so many people, not only on social media, on Facebook, on YouTube, that look, oh, the elders have conditions. Loneliness is a pandemic now. Depression in the elderly, very serious. And the most serious of them, Alzheimer's disease. And nobody's talking about them. I'm sure majority of people on this call will not know how how extensive that damage called Alzheimer's dementia is all about. So we need people like you, sir, to set up NGOs. I must also recognize that Mr. Kolawole Akindele is a wonderful tennis player. We socialize a lot at the Island Club. So, thank you very much, sir.
Thank you. Well, what we do in March is to create awareness. We started initially going to schools, churches, but we ran into a brick wall at some point, and then COVID came in. So we resorted to webinars, social media, and all. We intend to go back, but our audiences are not very friendly. Can you imagine? I go to a school and I'm coming to create awareness. And one of the conditions is that I must provide drinks and snacks for all the students. I'm coming to render you service and you're asking, provide water, and then you must keep some cartons, some snacks for the principal, right? Well, as I said, it's a struggle and we'll continue to do so. We can take one or two questions. Somebody asked a question in the chat box. It said something about Yoruba name, Shinwi, same as Alzheimer. False accusation is a common symptom in this condition. Thanks for the, can I scroll up a bit? Professor Coker, can you? Please provide insight on the adverse response to the disease, e.g., calling the sufferer a witch, and some have been stoned to death. Is the Yoruba name, is it Shinwi or Sinwi? Same as Alzheimer's. False accusation is a common symptom in this condition. Thanks for the brilliant presentation.
Yes, thank you very much. If Yoruba person says somebody Otisinwi means he has gone mad. So it's a general terminology for madness. We used to call it senile dementia. Onsharon, that is in Yoruba language, that he has forgotten the memory. They've always been within a community, but because of social media, because of education, people are now coming out to talk about their relations with their elders with mental disorders. And that's why, again, this kind of outreach program will also help Nigerians to identify elderlies that have mental disorders. Before we go, sir, I can recognize my wonderful people from Island Club, Yoruba Tennis Club, Ikoyi Club here on this call. I recognize Baba Agassi, Baba Gab, Dajoma, Baba Gab, Ijitime. They are all 70 plus, so this Baba are mentioning, and they are fantastic socialites. And that's why they're even seeking for more education and knowledge and information about their health. And that's why they're on this call. And I recognize Professor Ajayi, Professor Ajayi, and then Professor Ajayi male and Professor Ajayi female. Thanks for joining this call. My friend all the way from Kaduna, Pomi Ademoye, I recognize you. And also we have some doctors from LASUT here. I recognize all of you. Thank you so much. There's Professor Ike Ajayi says, up school, comprehensive high school. Yes, we have very, very buoyant old school association that we meet once every other month. And what Dr. Ubo said, we socialize, we call ourselves the names that we used to call ourselves when we were 10, 11, 12 years old. Thank you.
There is a question there. How can we manage the elderly who are narcissistic in nature?
A classical example of an elderly who is narcissistic is Donald Trump. And as you can see, he's so troublesome. And the elderly people who are narcissistic always think about themselves. But usually, the ones that are still effective and productive and have not lost their communication skills, we can still cope with them. The elderly who are narcissistic and have been aggressive, hostile, and lost their communication skills, those are the ones you need to go and see the experts.
Yeah, thank you so much. Thank you so much. We are coming to the end of this presentation. I'd like to thank Professor Rotimi Kuka for finding time to do this. He's very busy, but of course, this is his call, and he has graciously answered it. Just to say that we all are involved, either directly or indirectly. We are aging, some have aged. We all age differently. There could be 2, 3 siblings and they all age differently. All right, some have very wonderful memories. Some can recall a special, particular aspect of their childhood better than others. All right, so different aging processes. However, what we are asked to do is to socialize, keep aware, be abreast, read, discuss, join groups and all. Then for parents, if we can afford it, hire caregivers, because often those caregivers are more detached, are more professional in dealing with the elderly than we, the children. All right, so if you can provide a caregiver or provide caregivers, sometimes just 1 or 2, it costs a lot of money, but it helps. We should show understanding, knowing that we ourselves, by the grace of God, we get old. There is no guarantee at all that all of us will live to be 80, 85, but as we move on in age, let us show more concern. And then generally, mental health awareness, wherever we are, and let us put in the right words. I thank all of you for being here today. Some are here for the first time, some have been regulars. I thank all of you. We'll meet again at the end of this month for another wonderful topic. Thank you and good night. Thank you, Professor Kuka.
Yeah, for those who want the lecture, they should just reach out to you and then you can send it to every participant of this program, sir.
Okay. So please just put your email address on the chat box. We'll reach out to you.
Okay.
Thank you. Thank you. And bye. This it will be on YouTube shortly, and we'll give you the contact. Thank you. The link. Good night.
Bye. Thank you.